The hand. This anatomically complicated part of the human body has an amazing number of bones. There are 8 bones in the wrist, and they all create joints. Furthermore, metacarpal bones create a set of joints with proximal phalanges, and proximal phalanges create a set of joints with middle phalanges, and middle phalanges create a set of joints with distal phalanges. We have so many joints in our hands because we perform so many functions with our hands. It is extremely important to keep our hands and our fingers healthy, but dangerous conditions such as rheumatoid arthritis can affect one of those joints or more of those joints without producing significant symptoms. That is exactly what we have to explain. A clear diagnosis. How do we know whether a patient suffers from rheumatoid arthritis or not? Furthermore, we have to explain mysterious symptoms that might indicate that some deeper underlying issue is causing the symptoms. And of course, we have to explain the therapy options according to the guidelines. There are different types of arthritis, and we'll get to that in a minute. But first, let's focus on rheumatoid arthritis. Where does it all go wrong? This, what you can see here, are the B and T immune cells of the human body. The B cells can produce the so-called rheumatoid factor. Rheumatoid factor is an antibody that can create complexes with other antibodies and then deposit in the joints and contribute to the chronic inflammation of the joints. The T cells of the immune system will not produce antibodies and rheumatoid factor, but they can produce cytokines. Cytokines are pro-inflammatory molecules that cause inflammation and destruction of the tissue in the joints. Now, if we would open my chest like this, we could see a small organ here called the thymus. It is responsible for teaching these cells not to attack our own body. But clearly, in rheumatoid arthritis, something is wrong here. So what exactly goes wrong is not known yet. But sadly, we do know that additional immune cells called macrophages come to this region and they release enzymes into the joints and ultimately cause damage. They can also activate fibroblasts, and fibroblasts are supposed to repair the damage, but they cannot do it in the right way or in the right spot. And so the permanent damage to the joint is done, and this can have serious consequences for the life quality and health of the patient in the future. These dangerous developments not always cause symptoms, and therefore they can be hard to recognize. A lot of people suffer from rheumatoid arthritis, but they're not yet aware of it. So what can be done about it, and how can we easily diagnose it before serious damage has been caused? But before I explain this, I have to ask you something. You see, we have a problem here. We created this channel to help people suffering from rheumatoid arthritis and other conditions, and then we get hundreds and hundreds of comments posted by someone called Dr. Osaye. Honestly, I doubt that this person is even a doctor. He claims that he has some magical treatment that can cure all diseases, and they spam our channel. We get hundreds of comments just, flat out lying to the people that they can cure the diseases. I find their channel, and they have more views than we do. They have more subscribers than we do. I don't know what YouTube and other social platforms are doing with their algorithms, but we need to find a way to tell YouTube and other platforms that we're legit, and these guys are a scam. Think about how immoral that is. To find people suffering in pain and to scam them out of their money. You know they're suffering, and you know that what you're offering them does not work. So there are 3 things you can do, and we can also do one thing for you. 3 things are: you can share this video. Just grab the link and share it on your platform, on your accounts or social media with your friends. And then you can come back here to this video and just like it and subscribe. And then when you subscribe, you have to click that bell button, because YouTube will still not offer you our videos unless you click that bell button. It's not going to suggest you our videos. And then you can like the video. So that's what you can do for us. What we can do for you is you have a question about this condition, you have a question about rheumatoid arthritis, ask the question in the comment section. We reply within 24 hours. But now back to our joints. How to treat it? Well, the treatment of rheumatoid arthritis depends a lot on the underlying activity of these cells and the molecules they produce. There are 3 specific things I'd like to highlight when it comes to treatment of rheumatoid arthritis. First and foremost, we know that exercise and physical therapy help, but the first line treatment for rheumatoid arthritis is typically non-steroidal anti-inflammatory drugs. These widely used non-steroidal anti-inflammatory drugs, such as ibuprofen, are not the only drugs we use for rheumatoid arthritis. There are biologicals. Those are given by injection. JAK inhibitors are the newest drugs for rheumatoid arthritis. And DMARDs stand for disease-modifying antirheumatic drugs. Steroids can not only get rid of the pain, they can also reduce stiffness and inflammation in the joint. The mechanisms through which these cells cause damage to the joints are diverse, but so are the mechanisms through which these drugs try to stop that. So one size fits all definitely does not work here. The exact combination of medications will depend on other medical conditions, but also on the activity of rheumatoid arthritis. One combination of medications can do wonders for one patient and cause nothing but side effects for the other. If it's not enough to treat rheumatoid arthritis with medication, we can look at surgical options that are available. But we have to go all the way to the beginning, where the inflammation starts. Now, what is this over here? This is a bone, which with its head is articulating with another bone, and this constitutes a joint. Now, this part over here is the joint capsule with the synovial membrane, and that is exactly where the inflammation in rheumatoid arthritis starts. But rheumatoid arthritis does not only cause inflammation of the synovial membrane around the joints. If I were to open my hand like this, you would be able to see the synovial membrane over here as well, wrapping around the tendons of the muscles of the hand. If the rheumatoid arthritis causes an inflammation of the synovial membrane around the tendons, it can ultimately cause the tendon to rupture, and this has to be quickly repaired. Furthermore, if it causes the inflammation of the synovial membrane around the joint, it can destroy the joint surfaces, and this too can be repaired by simply removing the synovial membrane, and it can be done arthroscopically or through an open surgical approach. Surgery basically means that we have to go through the skin of the patient, and that is invasive. So let's first look at the diagnosis and how can we make sure that the patient indeed suffers from rheumatoid arthritis. There is no single clinical or lab test that can confirm the presence of this condition. So therefore, we have to look at these 7 criteria over here in order to diagnose rheumatoid arthritis. If the joint is severely damaged, it can be completely replaced. But before we get to any surgeries, because they're invasive, let's make sure that the patient indeed suffers from rheumatoid arthritis. In order to diagnose someone with rheumatoid arthritis, we have to look at these 7 criteria, and 4 out of these 7 have to be positive. The first criteria here to diagnose someone with rheumatoid arthritis is morning stiffness that lasts longer than 1 hour. Furthermore, soft tissue swelling of 3 or more joints. And the third criteria in this list is basically swelling of the proximal interphalangeal joints. Furthermore, swelling of the metacarpophalangeal joints and swelling of the wrist joints. The fourth criteria is symmetric swelling of the joints bilaterally. And these 4 first criteria have to be present longer than 6 weeks. The last 3 criteria for the diagnosis of rheumatoid arthritis are the presence of rheumatoid nodules. For example, here subcutaneously. That means under the skin. Furthermore, rheumatoid factor in blood tests can be positive, and radiological confirmation of the changes that are indicated in rheumatoid arthritis can be helpful. In radiological imaging for patients who suffer from rheumatoid arthritis, sometimes it is possible to see mysterious signs such as Heberden's nodes and Bouchard's nodes. These findings can indicate that the patient not only suffers from rheumatoid arthritis, but also from osteoarthritis. And this is really hard to deal with. And that might be an explanation why an appropriate therapy that is in accordance with the guidelines still does not help. But both of you, doctors and patients, we can all benefit from videos like these. If you're a doctor and you want to make a video like this one, then go to anatomsky.com. But if you have more questions about osteoarthritis, rheumatoid arthritis, just go to symptomsky.com/help/arthritis. And both doctors and patients can subscribe.